Let me start by recognizing our Deputy Minister who has just introduced me, Honorable Kwedini, our Permanent Secretary, Dr. Maunganize, Public Health Advisor to the President and Cabinet, Dr. Mawomva, Honorable Bajila, who is standing in for the Chairperson for the Portfolio Committee on Health, Deputy Chairperson of the Health Service Commission, Dr. Kangwende, and all members from the Health Service Commission who are here present. Permanent Secretary, I've already introduced you. Secretary for the Health Service Commission, Dr. Pasi. At one stage, I thought Dr. Pasi was not in here because yesterday I was sitting there. I think he was very careful that he never steps onto the podium today because the Deputy Chairperson is there. But I can now recognize your colleagues. I want to recognize all senior government officials here, our development partners. I don't want to mention them name by name because I might leave some out, but I've seen that row is filled up with all our development partners. I'm not only seeing Dr. Kalon, maybe he's committed somewhere. Distinguished guests, ladies and gentlemen, I think the atmosphere here today is very different and I can feel the fresh air, even from the prayer. Mr. today was in a different mood. And as people pray, I usually close my eyes. After some time, I open to say, where is this man talking from? And I really... Thank you, Mr. Mutare. I think we are now all in we can feel the spirit, which is a good spirit around us. I'm delighted to be here in the Eastern Highlands for the second time in 3 years for our model. I don't know, Permanent Secretary, whether you allow me to say model or let me say it for the last time. That is this ministry's strategic review and planning meeting. There's something about stepping out of Harare and coming to the Eastern Highlands, as Dr. Mkuzunga was saying. I think in the Bible, they also say, talk about, I don't know much about the Bible, but I think there's somewhere where they mention the wise men from the East. So this is the eastern part of the country, and maybe we thought there were too many wise men, that's why we decided to come here. I hope with the conversations, these conversations will be honest. Yesterday, our internal closed session allowed us to pause and reflect. We faced the hard truths candidly, and I want to thank the Deputy Minister and the Permanent Secretary and other senior leadership for guiding those discussions. We agreed that we cannot keep repeating old strategies with new covers. We need bold, practical, and measurable actions. The PS summarized yesterday's deliberations well in his remarks. Today, we open conversation to you, our partners and collaborators, because the health sector is a shared responsibility. Allow me to acknowledge His Excellency the President, Dr. D.T Mombeshora, for his guidance and Vision 2030. His mantra, Nyika inovakwa nevene vayo. That is, a country is built by its own people. And this reminds us that health outcomes must be driven by Zimbabweans, for Zimbabweans, with no one and no place being left behind. I also recognize the Excellency, the First Lady, as our health ambassador. A tireless advocacy strategy strengthens preventive health wellness and community engagement. This year marks a significant turning point. We are closing the chapter on National Development Strategy 1 and the National Health Strategy 1 and transitioning to the National Development Strategy 2 and National Health Strategy 2. Our vision for this sector is clear We will build a resilient, equitable, and high-performing health system where resources are used efficiently, services reach every citizen, and quality care is a right, not a privilege. To achieve this, we must focus on 6 priority areas. 1, we must strengthen primary and community-based health care. Too often, our central hospitals are overwhelmed because patients are not receiving care at lower levels. We will invest in community health services, outreach programs, and preventive care so that health reaches every doorstep. 2, health financing and sustainability are critical. Donor support is declining and domestic resources must increase. The National Health Insurance Bill, which we plan to table before Parliament by year end, will provide a stable, sustainable funding base and protect families from catastrophic health expenses. In short, more health for the money and more money for health. On this issue, those from policy department and our legal officers, I think from Monday, you have to be staying at the Attorney General's office to make sure you come back with the bill, the draft bill that has been completed, so that we make it to Parliament before the year end. If they don't give you, don't come to the offices. 3, public health capacity is a key pillar. The establishment of the Public Health Institute of Zimbabwe, that is PHIZ, supported by the EU, WHO, Africa CDC, and other partners, will allow us to detect, respond to, and prevent public health emergencies effectively. This will make Zimbabwe self-reliant in public health expertise. 4, human resources for health remain a top priority. Treasury has approved 14,000 new posts, with 5,284 to be filled before December. That is a huge challenge for our Health Service Commission, and we must engage with the Minister of Finance should we face challenges in implementing this. We must deploy staff strategically, improve conditions of service, and build a workforce that is competent, professional, and motivated. Retention, discipline, and equitable distribution, especially to underserved areas, will guide our approach. 5, digital health will be a transformative policy direction. By investing in digital solutions, we will increase geographic access to services, improve operational efficiency, and enhance data management for evidence-based decision-making. Telemedicine, electronic health records, and digital reporting systems will be central to achieving these objectives. 6, governance, accountability, and cross-sector collaboration are essential. Health is not the Ministry of Health's responsibility alone. Parliament, the Office of the President and Cabinet, the Health Service Commission, the Public Service Commission, other ministries, private sector partners, and civil society are all part of the solution. Only a whole-of-government approach, guided by transparency and evidence-based planning, will allow us to achieve our objectives. One Health is a key collaborative effort that shows the importance of multi-sectoral coordination in enhanced health security. Let's make this meeting a space for honest conversations, bold ideas, and co-creation of solutions. focused conversations are critical. So if anyone takes longer than 10 minutes to speak today, we may simply assume you are volunteering to sponsor the next tea break. Our development partners' guidance is vital as we shift toward sustainability and domestic ownership. The private sector are not just observers, you are co-architects of solutions. We must celebrate progress. Life expectancy is improving, maternal mortality is decreasing, Zimbabwe surpassed the 95 HIV targets, disease surveillance and outbreak response capacity is stronger than ever, investments in diagnostics, CT scans, MRIs, ICU care, and digital health systems are already transforming our hospitals. But we cannot ignore persistent challenges. Neonatal mortality, cholera outbreaks, service delivery gaps, and procurement inefficiencies. These are real and they demand action. As we move into NDS2 and NHS2, our vision is that Zimbabwe will have a health system that leaves no one behind, delivers quality care effectively and efficiently, responds proactively to emergencies, and is locally owned and sustainable. This is ambitious, but it is possible if we work together with honesty, commitment, and innovation. To Parliament, OPC, Health Service Commission, Public Service Commission, other ministries, private sector, and civil society, your role is central. Health outcomes depend on all of us. We will co-create the next national health strategy with you so that it is realistic, fundable, measurable, and implementable. With these remarks, it is my honor to officially open the 2025 Strategic Review and Planning Meeting with our partners. Let us engage with open minds, shared responsibility, and collective commitment to build the health sector for our citizens. Thank you very much. Let's get to work together. There will be no fights today.